Bismillahirrahmanirrahim. Assalamu alaikum students. Today we are going to start a new topic which is the coronary circulation. So what is coronary circulation? It is the circulation of the heart, circulation of the blood within the heart. As you all know that heart itself requires blood to meet its metabolic demands. As you know, heart is an organ which is always working, always pumping blood to your peripheral organs. So it itself requires blood to meet its high metabolic demands. So the blood vessels which carry blood to the heart itself are known as the coronary blood vessels, and this type of circulation is known as the coronary circulation. So there are two types of coronary arteries: the left coronary artery, which supplies the anterior and the lateral portions of the heart, while there is the right coronary artery, which supplies the right ventricle and the posterior part of the left ventricle. So, as you are already aware of the blood supply of the heart and the venous drainage of the heart, we will not go into these anatomical details. Let us start with the physiology of coronary circulation. So, what is the normal coronary blood flow? So, when you are at rest and you are not exercising, your body is not in sympathetic drive, you are at rest. At that time, your coronary blood flow is around 225 mL per minute. It is around 4 to 5% of your total cardiac output. Now, do you remember what your cardiac output is? The cardiac output is the amount of blood which is pumped by your heart per minute. So it is around 5000 ml per minute. Your cardiac output is around 5000 ml per minute. So the blood which is pumped per minute by your heart, out of this blood, around 4 to 5% is supplied to the heart itself to meet its metabolic demands, and this amounts up to 225 mL per minute. But when you start exercising and your heart rate increases and your heart contractility increases, and now the work which is being done by your heart is increased, so this 225 mL per minute is not enough to meet these increased metabolic demands of your heart. So to now meet the metabolic demand of your heart, the coronary blood flow has to be increased around 3 to 4 times the coronary blood flow at rest. So your heart has the ability to increase its coronary blood flow to 3 to 4 times the amount which is being supplied at rest. So during exercise, your coronary blood flow increases 3 to 4 times. Let us now discuss the special arrangement of your coronary blood vessels according to the depths in the cardiac muscle. Before we study the type of blood vessels, let us discuss the 3 layers of the heart. So suppose we have the heart over here, and this is the ventricle. If we take a section of the ventricle, we will observe that there are 3 layers which make up the ventricular muscle wall. So, or the ventricular wall. The outermost layer is known as the epicardium. The epicardium lies over a thick muscular layer which is known as the myocardium. This is the layer which is responsible for the contractile action of the heart. And deeper to the myocardium lies another very thin layer which is known as the endocardium. So now you know that the ventricular muscle or the ventricular wall is made up of 3 layers: the epicardial layer, which is the outermost layer, then we have the myocardium, which is actually the muscular layer, and then we have the endocardium. So these are the 3 layers which make up the walls of the ventricle or the heart. So let us now see how these arteries, coronary arteries, your left and right coronary arteries, are arranged around your ventricular muscle wall, and how do they succeed in supplying blood to the deeper layers of the muscle wall of your ventricles. So here in this figure you can see that there are present on the surface of the heart your coronary arteries, the left and right coronary arteries, and their main large branches. So these arteries which are present on the outer surface of the heart are categorized as the epicardial arteries. But how do these arteries supply blood to the deeper layers of the heart, such as the myocardium and the endocardium? The epicardial arteries give rise to deeper arteries which are known as intramural arteries. Intra means within, mural means wall. So these epicardial arteries on the surface of the heart, lying on the epicardium of the heart, give deeper branches which penetrate into the muscular wall, which penetrate through the epicardium into the myocardium, and these move downwards into the ventricular muscle wall, and these are known as the intramural arteries. Now these intramural arteries form a network or a plexus just below the endocardium. As I told you before, that the innermost layer of the heart is the endocardium. So just below the endocardium here is another plexus of blood vessels which are known as the subendocardial arteries or endocardial plexus of arteries, and this is the plexus which supplies the inner layers of your heart. So the subendocardial plexus receives the blood from the epicardial arteries through the intramural arteries. Now do you understand the organization of the blood vessels around the ventricle? So, to sum it up, the coronary vessels have a special arrangement at the different depths of the muscle of the heart. On the outer surface of the heart, you have the epicardial coronary arteries, and in the deeper layers of the heart, just above the endocardium, you have the subendocardial arteries, and these two arteries are connected by the intramural arteries. So, the outer epicardial arteries are actually the arteries which supply all the layers of the heart. These epicardial arteries, which is your left coronary artery and your right coronary artery and their branches, these are the actual arteries which supply throughout the depth of the muscle of your ventricle. The intramuscular arteries are actually derivatives or deep branches of your epicardial arteries which penetrate into the muscle and give off branches to supply the myocardium and also supply the endocardium through the subendocardial plexus. So this is the arrangement of your coronary arteries. Let us now discuss the pattern of coronary blood flow during the cardiac cycle. As you already know that the cardiac cycle is divided into two parts, the systole and the diastole. Systole is the duration of contraction of the ventricle, while diastole is the duration of the relaxation of the ventricle. It might be interesting to you that the coronary blood circulation does not remain the same throughout the cardiac cycle. In fact, the blood flow to the muscles decreases during the systole. So, every time the ventricle is contracting, the blood flow to the ventricular muscle decreases. Now, what can be the reason for this? Every time the ventricle contracts, it squeezes and compresses the intramuscular arteries. These are the arteries which I showed you in the previous slide. These were present between the epicardial arteries and the subendocardial arteries, and these were present within the ventricular wall. So every time the ventricle contracts, it squeezes these intramuscular arteries and occludes them and shuts them off, and no blood can flow from the epicardium to the intramuscular or intramural arteries or the subendocardial arteries. So this is the reason that the ventricles receive no blood supply during contraction. But as soon as the ventricles relax, these intramuscular arteries open up and the blood flows from the epicardial arteries into the intramural arteries and into the subendocardial plexus, and the blood can be supplied to the tissues of the ventricular wall. So you must remember that the blood supply to the ventricular muscle is phasic, and it decreases during the systole and it increases during the diastole. The reason for this is that when the ventricle is contracting, it occludes the intramuscular arteries and no blood can flow during systole. And you can see this in the graph that we have around 250 ml or around 300 ml of blood which flows in the coronary blood vessels, and the blood flow is maximum when the heart is in the relaxed form, and it is the minimum or there is very little blood flow when the ventricle is contracting. So this is the graph which shows the coronary blood flow during the cardiac cycle, and you must remember this graph and you must know how to draw it. So on this side, on this x-axis, we have the time, and these are the phases of the cardiac cycle, and on this axis, on the y-axis, we have the coronary blood flow in mLs per minute. And you already know that the maximum coronary blood flow is around 225 at rest. So what happens is when your ventricle is contracting, the intramuscular arteries are squeezed and they are occluded during the systole, ventricular contraction, and the blood flow through them decreases to around 70 or 60 ml. And throughout the systole, this blood flow is maintained at this very low level. As soon as your systole ends and your ventricle starts to relax and your diastole starts, these intramuscular arteries open up and the blood flow through them increases, and this is the phasic change during your cardiac cycle. Let us now discuss the control of coronary blood flow. What are the factors which control this blood flow to the heart? And as you already know, as I already mentioned, that your blood flow or your coronary blood flow is around 225 ml at rest, and when you start exercising, this may increase to 3 to 4 times this amount. So what are the factors which control your coronary blood flow? Your factors can be divided into two main categories: your local control and your nervous control. But you must remember that your local control is the more potent or the more strong factor which controls your coronary blood flow. So the local control is more important or more active than your nervous control. Your nervous control also has two effects: a direct effect and an indirect effect. And again, remember that your indirect effect is stronger than your direct effect. Let me repeat that your coronary blood flow can be controlled by a local mechanism and a nervous mechanism. Your local mechanism is stronger than your nervous mechanism. Your nervous mechanism has two effects: a direct effect and an indirect effect. You must remember that the indirect effect is stronger than the direct effect. Now let us study the details of these local and nervous controls. Let us first begin with the local control of coronary blood flow. What is meant by the local control? It means that it is the muscles of the heart themselves that will decide the amount of blood which is going to come to them, which is going to flow to them. So what is the major determinant of local control? As you already studied before, when I told you the local control of blood flow, it is the metabolites and the oxygen demand which will decide how much blood is going to come to the tissues. So the coronary blood flow is primarily controlled by local metabolites such as oxygen and local vasodilators such as carbon dioxide, hydrogen ions, lactic acid, and most importantly adenosine. But among all of these metabolites, the most important is the oxygen. So whenever the oxygen demand increases, the blood flow to the heart increases. So how is it detected? That suppose this is your cardiac tissue and it has started working a lot since you have started running or you are exercising. So now your cardiac muscle is working with greater effect, and it is the heart rate has increased, the heart contractility has increased. So now the demand for oxygen by the tissues of your heart is also increased because they are working really hard. So what happens is the oxygen within the cardiac muscle decreases and its oxygen demand increases, and this causes vasodilation of the arteries, of the coronary arteries, and the blood flow increases. So what happens is that increased cardiac tissue metabolism, it results in decreased concentration of oxygen in the cardiac muscle cell. Also, when the cardiac muscle is working, it is producing large quantities of vasodilators such as carbon dioxide, hydrogen ions, and potassium ions, and other products such as adenosine. As I told you before, adenosine is the most potent vasodilator in the heart. So this combination of decreased oxygen concentration within the cell and increased vasodilator concentration together cause dilation of the coronary arteries, thus increasing the coronary blood flow. Let us now discuss the nervous control of coronary blood flow. As you already know that the blood flow of your body, not only your heart, is controlled by your autonomic nervous system, which comprises of the sympathetic and parasympathetic parts. So whenever your nervous system is involved in the regulation of your coronary blood flow, it will have two effects on your coronary blood supply: a direct effect and an indirect effect. What might be a little confusing to you is that both of these effects are opposite to each other. Both of these have opposite effects. But you must remember that the indirect effect is more common and it overrides the direct effect. You have to remember this. First, you have to remember that your local metabolic control is stronger than your nervous control, and your nervous control has two parts, the direct effect and the indirect effect, and you have to remember that the indirect effect is more severe or stronger than your direct effect. Now let us discuss both these effects in detail so you can better understand what I am trying to explain. So let us now study the direct effect of the nervous regulation. What is the direct effect? The direct effect is when you are at rest, your parasympathetic nervous system will be activated, and when you are exercising or when you are sympathetically active, your sympathetic nervous system will be activated. So as you already know that when your parasympathetic system is activated during rest conditions, acetylcholine will be secreted at the end of your parasympathetic nerve fibers. Please remember that this acetylcholine causes dilation of the coronary arteries. So during rest conditions, your parasympathetic nerve supply is going to be strong within your heart, and these parasympathetic nerves are going to secrete acetylcholine at their endings, and acetylcholine dilates the coronary blood vessels. So what happens when there is sympathetic stimulation of the heart? As you already know that when there is sympathetic stimulation of the heart, there is going to be secretion of epinephrine and norepinephrine at the end of your sympathetic nerve fiber. But you must remember that the norepinephrine, which is secreted at the end of the sympathetic nerve fibers, is greater in quantities than the epinephrine. I have already told you about this in previous lectures. मैंने आपको पहले भी बताया था कि जब भी sympathetic activation होती है within the body, there are two phenomena which take place. One, there is secretion of epinephrine and norepinephrine at the end of sympathetic nerves. Here norepinephrine is greater in quantity than the epinephrine, and secondly what happens is there is secretion of catecholamines from your adrenal glands which are present on the top of your kidneys, and यहाँ से जो secretion होती है उसके अंदर epinephrine is greater than norepinephrine. Now do you remember? So let us discuss this further. As I mentioned before, that the norepinephrine acts on alpha receptors and causes constriction, while epinephrine acts on beta receptors and causes dilation. If you cannot remember this, there is a simple mnemonic which can help you to remember it. The mnemonic is can and bed. So as you know that your norepinephrine acts on alpha receptors which causes constriction. ठीक है, तो आपको ये कैन निमोनिक याद रहेगा. Norepinephrine acts on alpha receptors which causes constriction, while your epinephrine acts on beta receptors which causes dilation. So what happens is your epinephrine acts on beta receptors and this results in dilation. Now if you remember the arrangement of the blood vessels around the ventricle, you will remember that there are present the epicardial arteries which are present on the outer surface of the heart. These epicardial arteries give deeper branches which are known as the intramuscular arteries, which supply the inner portions of the heart through the subendocardial plexus. So what is important here is that these epicardial arteries have alpha receptors on their surface, while the intramural or intramuscular arteries have beta receptors. So whenever there is sympathetic activation, norepinephrine is going to cause the constriction of the epicardial arteries, and epinephrine is going to cause the dilation of the intramuscular arteries. Now how is this helpful? What will happen is that the epicardial arteries will squeeze and push their blood to the deeper layers of the heart, and the deeper arteries will dilate to receive this blood. In this way, blood can be supplied to the deeper portions of the heart whenever there is sympathetic activation. Let me repeat that the arrangement of the blood vessels is so that the outward vessels are known as the epicardial vessels which are present on the surface of the heart. The deeper vessels are known as the intramural vessels. On the epicardial vessels there is present alpha receptors. On the deeper vessels there are present the beta receptors. Epinephrine is going to act on the beta receptors and norepinephrine is going to act on the alpha receptors. So whenever there is sympathetic activation, there is the epicardial vessels are going to be constricted, so their blood can be pushed into the intramuscular arteries and into the subendocardial plexus, which will be dilated because of the epinephrine, and when the blood comes from the epicardial vessels into the intramuscular vessels, this blood can be supplied to the deeper portions of the heart. तो फ़ायदा क्या होगा, जब आपकी सिंपैथेटिक एक्टिवेशन होगी, आपकी epicardial vessels blood squeeze करेंगी to the vessels which supply the deep portions of the heart, so your blood supply, so that your blood vessels can adequately supply blood to the deeper portions of the heart. So this is very helpful during the sympathetic activation. So this was the direct effect, यानी कि डायरेक्टली आपकी सिंपैथेटिक और पैरासिम्पैथेटिक नर्व्स किस तरह आपकी वेसल्स को डायरेक्टली डायलेट और कंस्ट्रिक्ट कराती हैं. नाउ लेट अस डिस्कस द इनडायरेक्ट इफेक्ट. So what happens during the indirect effect? What happens is that whenever you are at rest, your parasympathetic nervous system is activated. What happens is acetylcholine is going to be released at the end of your parasympathetic nerve fibers. This acetylcholine is going to reduce your heart rate by affecting on the SA node. What happens is, this is your heart, this is your right atrium. In your right atrium is present your SA node, and your parasympathetic nerve fibers are always supplying your SA node. So whenever there is increased parasympathetic activation, acetylcholine will be secreted at these nerve endings, and it is going to slow down your SA node. When your SA node is slowed down, your heart rate will decrease. When your heart rate will decrease, your heart contractility will also decrease, and this will decrease the metabolism of your cardiac muscles. जब हार्ट ज़्यादा काम ही नहीं कर रहा तो उसके मसल्स का मेटाबॉलिज्म भी डिक्रीज हो जाएगा. The oxygen demand will decrease, and the vasodilators which are being produced will also decrease. When there is decreased formation of vasodilators, there is going to be potent vasoconstriction. So this is how, when you are at rest, the blood flow to your heart decreases. And this is very logical, because you are at rest. You do not need large amounts of blood supply to your heart. That is the reason I told you that your indirect effect, which is opposite to your direct effect, is more strong and it overrides your direct effect. अगर आपको याद होगा, हमने डायरेक्ट इफेक्ट में क्या पढ़ा है कि एसिटाइलकोलिन आपकी कोरोनरी ब्लड वेसल्स को डायलेट करती है और ब्लड फ्लो इंक्रीज़ करती है, लेकिन हमें इंक्रीज्ड ब्लड फ्लो की ज़रूरत ही नहीं है, क्योंकि हम अभी रेस्ट पे हैं. एट पैरासिम्पथेटिक स्टिमुलेशन, योर बॉडी इज़ एट रेस्ट. इट डज़ नॉट रिक्वायर लार्ज क्वांटिटीज़ ऑफ ब्लड टू बी सप्लाइड टू योर रेस्टिंग हार्ट. सो what is the indirect effect? In the indirect effect, your parasympathetic stimulation causes decreased heart rate, decreased contractility, which will reduce the metabolism of your cardiac muscles, and decreased metabolism will result in decreased formation of vasodilators. When there are less concentration of vasodilators, then there is going to be vasoconstriction of the coronary blood vessels, and the blood flow to your heart will decrease. Opposite will happen during your sympathetic stimulation. When you are exercising or when you are in stress, what happens is your sympathetic nervous system becomes activated. It is going to secrete epinephrine and norepinephrine. Epinephrine and norepinephrine are going to increase your heart rate, increase your cardiac contractility, increase your cardiac activity, and this will result in increased metabolism of the cardiac muscle. What would happen is your oxygen demand will increase as your oxygen concentration will decrease, and there will be increased formation of vasodilators. These vasodilators are going to cause vasodilation of your coronary blood vessels, so the demands can be met for the high metabolism of the heart or cardiac muscles. So this is the indirect effect. I hope you understood. Direct effect क्या है? Sympathetic और parasympathetic nerve supplies nerves का direct आपकी coronary vessels के ऊपर dilation या constriction कराना. What is the indirect effect? It is the constriction or dilation caused not directly by stimulating the blood vessels but by changing the heart rate and the contractility of the heart. So this indirect effect, although it is opposite to your direct effect, but this is more potent and more strong, and this drives the circulation of your heart. So in the end, let us discuss the effect of exercise on circulation. As you already know that during exercise, the cardiac output increases to meet the high demands of your muscles, which are hyperactive and require greater than normal oxygen and nutrients. And how does this cardiac output increase, and what are the effects of exercise on cardiac output? Let us discuss these in detail. So when you begin, even before you begin exercising, when you just think about exercising, what happens is your cardiac output increases. Now how does this happen? That you haven't even started exercising, you have just thought about exercising. So what happens is when you think about exercise, the cortex, or which is the area which is concerned with your thoughts, sends signals to the hypothalamus, which is the center for your autonomic nervous system, and these signals activate the sympathetic system, and this sympathetic system causes increased heart rate and increased cardiac contractility, thus increasing the cardiac output in anticipation of एक्सरसाइज. अभी एक्सरसाइज शुरू भी नहीं की और जस्ट उसके बारे में सोचने से ही सिग्नल्स आर सेंट फ्रॉम योर कॉर्टेक्स टू योर हाइपोथैलेमस, एक्टिवेटिंग योर सिंपैथेटिक नर्वस सिस्टम एंड इंक्रीजिंग योर हार्ट रेट एंड हार्ट contractility. So now when you begin exercising, what happens is your sympathetic nervous system sends signals to your vasomotor area, which is present in your brainstem, and causes the vasoconstrictor area to be activated. Now this vasoconstrictor area is going to cause massive vasoconstriction all over your body, especially in your skin, in your GIT, which is your gastrointestinal tract, and in your kidneys, and this is helpful in diverting the blood from the skin, from the GIT, from the kidney towards the muscles. And as you know that during sympathetic activation there is vasodilation of blood vessels within your muscles. So muscles के अलावा बाकी हर जगह बॉडी में vasoconstriction कर दी जाती है during fight and flight. So blood can be diverted to your muscles, and also of course your brain, your lungs and your heart. यहाँ इन तीन जगहों पे भी vasodilation होती है, so that you can overcome any fight or flight condition. So the second point is that there is vasoconstriction in the non-essential organs of your body, such as your skin, GIT and your kidneys. So the blood can be diverted to your muscles where there is vasodilation, and also it can be diverted to your heart and to your brain and to your lungs. Thirdly, there is also a local control of circulation. When you have been exercising for some time, there is production of vasodilators and waste products in your muscles. These vasodilators like carbon dioxide, hydrogen ions, lactic acid, potassium ions, adenosine, etc. are going to cause local vasodilation within your muscles. And as you know, the more the blood which will come to the muscles, more of it will be sent back towards your heart in the form of venous return. क्यों? क्योंकि venous return is the sum of all local circulations. When local circulations blood to the local circulations increases, blood flow towards the heart in the form of venous return also increases, and when the venous return increases, your cardiac output also increases. So when there is local increased local blood flow in the muscles because of vasodilation, there is going to be increased venous return and increased cardiac output, and this increased cardiac output is going to help you during exercise to meet the raised demands of the muscles. And fourthly, we have the compression of abdominal muscles during exercise. When you are running or you are exercising, there you will feel the abdominal muscles are tense and they are compressed. What they do is, when these abdominal muscles are contracting, they squeeze your internal organs, especially your GIT, and the vessels which are present in your abdomen are also compressed. This helps in pushing this blood towards the heart by increasing venous return, and this increased venous return will cause increase in cardiac output. So whenever you are experiencing strong sympathetic stimulation, or when you are exercising, your abdominal muscles are going to compress your blood vessels which are present in your abdomen, and other organs such as your liver and spleen which are full of blood, and due to compression this blood is going to be returned to your heart in the form of venous return, and increased venous return results in increased cardiac output. So, this is how your cardiac output increases during exercise. I hope you understood. If you have any queries, please leave them in the comment box. In the end, I would like to add this very important definition, which is known as the cardiac reserve. Now, what is the cardiac reserve? It is the difference between your resting cardiac output and your maximum cardiac output during exercise. So, it is the difference between your cardiac output at rest and your cardiac output during exercise. It is maximum in athlete. The value of cardiac reserve is maximum in athletes and in other sports person. The formula for cardiac reserve is the maximum cardiac output minus normal resting cardiac output divided by normal resting cardiac output multiplied by 100. So, this definition is very important for your viva and also for your written examinations.